Okay, so time to learn blood flow through the heart. So there are three different vessels that we're going to talk about that are going to be bringing blood into the right atrium. You've got your coronary sinus, you have your inferior vena cava bringing blood from the lower body, and then you have your superior vena cava bringing blood from the upper body. Okay, all of those are going to lead into the right atrium, and this is where blood flow through the heart starts regardless of what pathway we're talking about. So we go from the right atrium through the tricuspid valve into the right ventricle. Then we go from the right ventricle through the pulmonary semilunar valve into the pulmonary trunk, which will then branch into the pulmonary arteries. Those pulmonary arteries will continue to go into the pulmonary arterioles, to the capillaries. In those capillaries within the lungs, we'll do gas exchange, and then blood is going to come back through venules into these pulmonary veins that you have here on both sides, and then all that blood will then come here into the left atrium. Then through the bicuspid or mitral valve into your left ventricle, through the aortic semilunar valve into the ascending aorta. Okay, from there, it can go a number of different places. It could go to feed the myocardium via these coronary arteries. It could go up through the aortic arch and through these vessels right here to the upper body, or it can continue on through the descending aorta, again, which we have our thoracic and then our abdominal that we will learn, or that I'll show you later. Okay, so every single pathway starts at every pathway has to go through the heart. And so what is similar on every single pathway is from the right atrium to the ascending aorta. It's before and after those two that things change. Now let's do blood flow to and from the myocardium. Okay, so we'll actually go from the myocardium and then go to the back to it. So we have our great cardiac vein on the anterior side, our middle cardiac vein on the posterior side. Both of those are going to go into this coronary sinus. From there, the blood from the myocardium that's come from the anterior and posterior sides of the heart will go into this coronary sinus, right, and then into the right atrium. So it'll go directly into the right atrium. And then it goes through the heart, everywhere, to the lungs, back, and then we get to that ascending aorta. From the ascending aorta, you have this right, you can see right there, the little nub of the right coronary artery, which would continue along here. Okay. And then as it continues into the posterior interventricular artery, the left coronary artery is going to come through and around, and you're going to have your circumflex artery, but it's also going to branch into this anterior interventricular artery to the anterior side of the heart. Okay, so that is your blood flow from the myocardium and then to the myocardium. And remember, in between, you have those steps through the heart and through the lungs and back to the heart so that we can bring blood to the myocardium.